Hollycotton here, and I have a very interesting show for us today. So I have Kionna and Qutrelia, who we're going to call Key and Q. I love that. And so they actually have something that happened to them, and they're going to tell us what happened and also what they're taking from what happened to them to stop it from happening to other people or just find people with like-minded ideas. How can we stop doing this? What is going on? Me being in the medical field, I love their mission. So we're going to get into all the details in a few minutes. So welcome, Key and Q.
Thank you.
Okay, so first of all, like I said, anyone that follows me listens to my show, they know that I'm a nurse. I've been a nurse for quite some time. So I do know about disparities in the medical field. I do know about minorities in the medical field. I actually had an ENT on my show who was saying how only 1% of doctors are African American. So I'm like, oh, okay, well, 1%. They love that 1% number. So you guys being in the medical field and you faced something that basically challenged you guys, and we're going to let you tell the story. We're not going to say anyone's name because we don't want anyone to, come from me on my show. But I do want to know all the details because you guys were discriminated against, correct?
Correct.
Okay, so tell us the story of exactly what happened.
So
You can start. You
okay.
can start.
So
Tag team.
All right.
so Kiana and I, we went on a travel assignment during COVID, and basically it was out of state. Our first day there, it just felt odd. We walked on a unit. We're both, well, I'm from Louisiana. She's from North Carolina. So we have that Southern hospitality. You know, we speak to everyone that we see. And so we went on a unit, and it was just like everyone was just staring at us. If I'm not mistaken, we probably were at least 4 African Americans on the unit. So that first encounter was just like, this feels weird.
Right. So they weren't really friendly with us. The first night we actually worked the floor, Q was, cleaning off her workstation and getting ready to start her shift while 3 Caucasian techs kind of stood off in the corner and were looking at their phone, laughing and mocking old Negro spiritual. Q wore like a surgical bonnet to keep her hair clean because it was during COVID. And they were in the corner singing, the old Negro spiritual as our ancestors would have sang it. So she came to me and was like, let me tell you what happened. This is our first night. And I'm like, you're lying because this is our first night. So time went on and other incidences happened. I wore my head wrapped one night and somebody asked me where I was from and I told her North Carolina and she was like, no, like, where are you really from? It took me aback. I'm like, well, I was born in Miami, but, I don't claim Miami because we moved when I was young. So she was like, well, what's with the head wrapped in? And I'm like, I don't think you're supposed to say things like that to people. So that was another incident. They constantly asked us how much money we were making. And, giving us harder patient assignments. My very first night, they asked, was I comfortable with ICU patients? I'm like, sure. And the patient was not stable at all. And he was a DNR. And I'm like, his heart rate is in the 30s. His blood pressure is in the tank. What are we doing? And why was he moved from the trauma bay to back on the backside? So just, felt like they were trying to sabotage us. So we went to the manager initially and, expressed our concerns to her. And she assured us that she was going to gently remind her staff. We did let her know, like, we didn't feel wanted there. And she said, you're wanted here, but our staff knows how much you're making, so they can be a bit jealous. But I'll gently remind them. There was no follow-up from that. The incidences kept occurring. It was a nightly thing to where it was like we hated going to work. Like, you're getting headaches, you're getting stomach aches, you're having anxiety. There's no patient ratio there, so you don't know how many patients you're going to have. And we eventually went to our travel company and let them know everything that was going on. And they told us that they were going to get attorneys involved and, let us speak with the attorney about everything going on. So we were looking forward to finishing our contract. We just didn't want to be harassed. We don't want to quit. We don't want to leave. If we're not going to be able to work here safely, then we'll just go to another hospital. That's no problem. So the attorney ended up talking to the hospital first and then tried to circle back and come and talk to us. So at that point, we didn't feel comfortable speaking with those attorneys. So then we saw our own legal counsel. You want to take it from the first time we met with him?
So, of course, us being out of state, not quite familiar with Michigan. So we ended up finding an attorney, free consultation. We get there, and his first question was, "Are you all vaccinated?" And I don't know for you, but for me, I think that's a personal question. That's like you personally asking someone about their medical records. So me and Kionna just looked at one another like, are we serious? Like, this is the first question. We're in here for discrimination, termination, and you're basically asking us our vaccine status. So we explained to him exactly what happened. And so when I explained to him in regards to the three texts singing the old Negro spiritual, he asked to hear the song, which I had no problem pulling it up. So he basically listened to the song, and then he asked us,
"What's wrong with the song?
What's wrong with the
What's
song?"
the problem?
As he bobbed his head to the song. So that took us back somewhat, because it was like trying to explain to other ethnic groups exactly what our experience has been a difficult situation for us, because some people don't see it as being pervasive. I know the EOC mentioned to us that my situation wasn't pervasive, and I'm like, who dictates? Where is there, a range of what's considered pervasive for one individual? So basically, that created a situation for us as far as us just like, who can we trust? Like, are we tripping? Like, what's really going on for someone to think that it's appropriate for three Caucasian individuals, where at this time there were patients everywhere. There were patients in the hall. There were patients everywhere. So you think that it was appropriate to be on your phone and to mock my ancestors? That I was taken back by that. I've experienced racism in the healthcare, but this was a different type of racism, where you did it in my face. So, yeah, that was the experience with our first consultation with an attorney.
So back to work.
And you guys were still working while this was going on, or you were that you guys had already parted ways with with the assignment? So you guys were still working while you were seeking the lawyer?
Yeah.
Okay.
So the day I reported the incident to my travel company, the lawyer reached out 3 days later to speak with us, but they had already spoken with the hospital. So at that point, I didn't feel comfortable speaking with them. And 17 days later, we were terminated. Hold on. Okay. The night I got terminated, I had 4 patients. 3 of them got beds at the same time. So I called report. We work in the emergency room. So I called report to the nurses upstairs. I put in the transport request for them. I went and checked on my one patient who I had left settle. Actually, he was a shortness of breath that they had in the hallway that I said, hey, he needs to be moved to a room because he needs to be monitored and on oxygen. So tucked him away. I told the float nurse, hey, I'm going to step off the floor for a second. And I went to another nurse's room to see if she needed a hand. And then I went to the break room to take a break. And this was around, I don't know, 10:30. Mm-hmm. So Q texted me it was exactly 30 minutes when I got in the break room to help with the catheter because it's a 2-person at this hospital. So we went and helped her with the catheter. And the float nurse that I told that I was going on break was the same nurse that went to management and told them that they couldn't find me for over 2 hours. So he saw me on the floor. If you log into the computer, you see that I was logged in. They said that I wasn't charting on any patients. I didn't have any patients except for my one patient who was already squared away, waiting to be dispoed. And I was in her room helping her. And we crossed paths in the hallway because we had to go get the supplies for her catheter. In addition to that being a reason for termination, they said that we were discussing our pay, which was not true. We went to them to say, hey, your staff is continuously asking us and making us uncomfortable, by asking us how much we're making, which is also against the law, the NRLA. You can talk about that, as well as they said I didn't answer call lights and that I said my patient was annoying. The unit secretary called me every time the patient pushed the button. He was anxious, to which I reached out to the doctor and said, hey, he needs something to help him rest because he's pressing the call light every 10 minutes and it's not conducive for him or for me because I'm going in the room only to console him. He doesn't need anything, which I don't mind doing. But I went in the room several times. Q went in the room several times. Other people went in the rooms. He was just excessive on the call light, to which she suggested that I pull the call light out of the wall. That to me is egregious because this man is a fall risk, shortness of breath. He has a lot of medical problems. And to pull the call light out of the wall puts him at a risk for a fall and an injury because he's annoying to you. I'm not getting annoyed. I'm going to go in the room every time he presses the call bell if I can. So the very things that they terminated me for, I have very specific documentation that is not the truth. So we know that it was discrimination and they plotted to get us out of the door after we opted to come forth with these discriminatory acts. Yeah. I don't know if that's the right terminology.
Needless to say, also, when we brought it to our travel company's awareness, we spoke with a clinical liaison for the travel company, and we brought to her our concerns. She stated that this was not the first time she heard this in a short period of time at this specific facility with discrimination. So she mentioned that to us. She also, we inquired, hey, is this something that we need to be concerned? Is there a possibility that they may, terminate our contract? And her specific words were that they may basically say that you did something clinical, but clearly you didn't. And that if that does happen, then we will put you on another assignment. So at that time, even the president reached out to us and he was informing us that there were travel assignments in Massachusetts as well as California. So we also spoke to the president of the travel company. So to basically turn around and terminate us for something, now hers was abandonment of a patient. Mine was abandonment. They said that I was a no call, no show. But basically, the email states that Q Johnson called in. And so then throughout the email, then it changed to she abandoned the assignment. And I didn't abandon assignment. A no call, no show means that I did not call in to make you aware. And that same night is the night that I spoke with the attorney. So the company knew that I called in, but at the same time, the next morning, they ended up terminating me, saying that I was a no call, no show.
Right.
Hmm. So, what I wanted to just kind of go back for anyone that's listening or that watches these clips, and as someone who's been in healthcare for a very long time, I will attest that there are lots of things that happen that are very prejudiced and um, very discriminatory to all of us that have any type of pigmentation in your skin. So I know people will all they whenever they hear your story or whenever they hear any minority that's complaining about being discriminated against, a lot of people, they start thinking that maybe you're making it up or you're over exaggerating. And like I said, I just wanted to also kind of jump in and say that I definitely can understand everything you're saying, because I've gone in rooms before when I was a floor nurse, where people, I always tell my students I've been called every name in the book, because people can't ever figure out what color to call me, so they don't know what derogatory slang to call me. So whatever race it is that they think I am, they're gonna call me the slang for that one. So I have been called everything in the book and yelled at and hit and whatever. People do not realize, first of all, just the emotional stress that it is on healthcare workers just to go in and give you care, because they are very ungrateful just going on the floor and helping people. And, I say also that if you're going into the medical field thinking that you're going to get appreciated for saving lives, you're not. You're not. So don't go into it thinking that
Yeah.
you're going to be like, Jesus is going to come in and then people, oh, thank you for saving my life. I have resuscitated six people, and I never even got a thank you. And I'm like, I brought y'all back
Literally.
to life. Six people. And I don't even never a thank you card. You should be sending me something for Christmas every year. Hey, still here? Nothing. So I totally understand that part, but I wanted to just add that to it, because people don't understand, one, just the stress, no matter what color nurse you are, the stresses that go on it, and then to come in as a minority nurse because you're already undermined with what you're saying, what your recommendations are, why are you saying this, well, where is the doctor, where, so there's all these things that are still going on, even 2023. So that's a huge thing I wanted to just interject for anyone who thinks that this is not a real situation that's going on. So that kind of segues me into my next question of what I wanted to ask. And so now that you guys had this experience and you guys came together and you're like, this is messed up, we need to do something. So when did that thought process come into your head? Like, we're angry that this happened, and now what we want to do is take our story and share it and sort of stop it from happening to other people.
For me, it was the same day that I got terminated. I have a small child that I was away from. I was flying back and forth to see him. Q's mom was diagnosed with stage 4 cancer during that time. So we were, basically working this contract to better provide for our families. So to have been treated that way and then to turn around and be terminated, to me, I was furious. I've always been for the advancement of our community. And instead of, adjusting the environment, they would rather get us out the door because we're quote unquote whistleblowing. So from that day forward, I have dedicated blood, sweat, and tears to pushing this cause, because it's not right. We go to school, we have student loans. We deserve to be treated with respect from our coworkers. We already get it from the patients, and we give people a lot of grace because we work in the ER. This might be one of the worst days of your life, so I'm giving you a pass. But to get it from your coworkers that I showed up as a teammate to help you, and you treated me like we're in 1922, I'm not having it. So ever since that day, we've reached out to the EEOC. We went through months, 18, 19, 24 months of investigation, to which they, said it wasn't pervasive enough. Basically, like, they would have had to call us something derogatory to our face. Playing explicit rap song at the nurses station with the N-word in it while the white nurses are walking around singing it freely is not pervasive enough. So then we saw legal counsel and are just, hit a brick wall. We're like, you know what, let's just put it on social media, because I know for me personally, I'm getting kind of discouraged. I'm like, well, maybe it isn't that big of a deal. Maybe, it's like you start to gaslight yourself a little bit. And to get all the comments from other nurses saying, this happened to me, this happened to me. And it's just like, okay, this is a real issue in healthcare. One of the many issues in healthcare. And we just want to create a platform for other nurses to speak out and tell their story. We know the risk of bringing it forth. We've already been terminated, so we understand the risk. But I'm willing to be sacrificed for the next nurse, for people who actually come in and love nursing, because we've all worked with nurses who you question, and you're fearful. Honest to God, you're fearful for their patients. And there's still good nurses out there with good hearts who are continuously learning, and we need to keep those nurses around and not run them out of the medical field because somebody else is insecure about whatever it is they're insecure about.
I love that. I love that. I love that. And I love that you did say that you did mention that when you started posting about it, you were getting all of this feedback. Like that's whenever you really know, wow, okay, because people will really have you thinking you're the only one going through
Woo.
something, and you're the one that's crazy. Well, what did you do wrong? Well, what did you do to cause it to happen? Well, why did you put? Well, why were you eavesdropping on their conversation? Well, why, like they always spin it around to where you're the one that's at fault to justify someone doing something that's not right, which is why companies now have all of these continuing education classes that they force you to take, these annual trainings on culture and sensitivity, and now everything is a diversity, inclusion, and equity, whatever, DEI. And so now that's why there's this huge push. But just because you force people to take classes does not mean that they're going to change their behavior. A lot of people were raised that way, especially like you said, from the South. I grew up in Louisiana as well, so I know rednecks when I see them. I mean, I grew up with, I have family that are part of that posse too, unfortunately. So, I love that you guys are able to find other like-minded people or other people who unfortunately have this experience as well. It's better whenever you have, hey, I had a great experience, and then everyone's like, oh, I had a great experience too. But this is like, no, I had an effed up experience, and now you have all these other people that are like, well, dang, I did too. So I love that you guys are getting that validation as well, unfortunately, but at least, we can try and use this to do something. Now, with all of that being said, what is it that you want from telling your story? What is it that you guys are saying, you know what? Because it's easy to say, I don't want another nurse to have to go through this. That's not really concrete. That's real. That's a broad thing. Because of course we don't want anyone else to get cancer, to get sick, to have lung disease, to do, we don't want those things to happen. But what are you guys trying to do with your story specifically? What is your mission and your goal with sharing your story?
So
Yeah, Q, because you didn't answer the last time. It's your turn.
um I think for me, of course, like Kionna mentioned, to bring awareness, but I also think it also put us in a financial bind. Like she mentioned, she has a son that she was responsible for during this time. My mom was diagnosed with stage 4 cancer. She had to resign from her job, and basically, I was providing for her. So it definitely put us in a financial bind. And I think that it's only right for us to be compensated for the emotional distress, for the defamatory words that they use towards us, as well as us not even being able to go back with this company for an assignment, which this company was having the highest contracts that were available. So as well as bringing awareness, compensation, and just wanting to, like Kionna said, just tell our story to let other, not just nurses, but Black professionals know that there needs to be a movement. We're in 2024. There's no reason that we cannot go to work and just basically have a healthy environment to be able to work in. It's unfair.
Right. And to add on, we definitely want to be compensated, because I think that's when people start to pay attention and start to listen, when you have to come out of pocket. But also, like she said, to create a movement, because like you said, this is their culture. No amount of classes is going to make you change. So at least creating a safe space and an environment for nurses to speak up when they have been discriminated against, to not sit back and take the back seat. We weren't the only nurses discriminated against there, but we were the only ones who spoke up about it and got terminated. So just creating a space to say, hey, you can come forward and you're going to be safe in coming forward. I don't think people are going to, they're not going to change if they don't want to change. And you feel like it's okay to go to work and treat people like this, it's not okay. This was 2 years ago, and every job we've had since then, it's like we're on edge. Like, oh, the manager sent me an email. What does this mean? Or what does that mean? And you're just feeling anxious. And it's like you have to be at your sharpest to be attentive for 12 hours to somebody. You got to be paying attention to labs and, fall risk and sepsis alert and all of these things. But when you have somebody on the back end, you're feeling like they're trying to sabotage you. That's emotional distress. And it's not fair and it's not right when all we wanted to do was go to work. So I definitely want to create a space for Black nurses and Black professionals, period, because there's people on the post saying, hey, I'm in social work, that happened to me too, or I'm a truck driver, that happened to me too, or it's not it's the African American culture, it's the people of color culture. So I want us to be able to come forward and not be penalized. And if we are, maybe we need to create our own. Yeah.
Right.
Consequences,
Right.
and create our spaces for us that we won't be discriminated against. We went into this field not for the money. It's not. You are not going to become rich being a nurse. I don't know where they started that, but most nurses have 2 and 3 jobs, working PRN, working overtime, and we do it because we love these patients. We have cried with these patients, held these patients. Patients have called the hospital and got our numbers and called us, said, hey, I just want to give you an update on what's going on. Like, we're in it for the right reasons, and you don't find a lot of nurses like that. But this is like pushing good nurses out of healthcare, because it's like, I don't even want to deal with that. If I got to deal with it, y'all can have it back. So.
And what I wanted to ask too, because it made me think whenever you were talking about changes in healthcare and things that you would like to see. So my question that I'm asking you guys, as someone who's on the outside looking in at your situation. So now that it happened and it's been a while since it happened, when you look back at it, what do you think that management could have done basically at the very beginning? Because it's always like, well, now that I'm looking at it, on this, when I went in this first time, if they went in and did this or they did that, or or whatever, then maybe I wouldn't be here, or that wouldn't have done this, or that wouldn't have done that. So when you're looking at the trajectory of how this happened, the situation, all the situations, because it was multiple times, when it first happened and it was that first incident, what do you think that management could have done to nip it in the bud or eliminate it from going as far as it did?
Basically what she said that she was supposed to do. She mentioned that she was going to speak to her staff, and she was going to advise them once again that they're here to help. No one is trying to take you all's job. This is a crisis contract. You all are in need of nurses, and basically it's helping alleviate your load as a nurse. But prior to us even getting there, September, there was an article that mentioned that their nurses were already having issues with the travel nurses coming in. So this wasn't new to them. because Kionna and I, our contract started in December. So months prior to, they knew that they had issues with their staff. So I do think that the manager had a responsibility of having a meeting with her staff, as well as we come to find out that she didn't even mention she talked to us. So she didn't even bring it to her higher ups that these nurses have come to me with concerns. There's no documentation that we spoke with her.
Okay. And so if you were a manager and you start, like if you were on the floor and you were a manager now, like who you are today, Key and Q. I love that. Who you are today, and I'm talking about you as a black manager. And so if you had a white employee that came to you and they had similar things that they said that they felt like they were being discriminated, just so we can be all inclusive here, how would you handle that being with the roles reversed?
I personally would have a staff meeting. I'm very forward. Like, let's get everybody in the room so no information is misconstrued. So and so said that this happened. I want to get everybody's story so we can get it all together. And I'm very big on conflict resolution. So if everybody needs to feel comfortable at work, we're all here for the same mission, one band, one sound. So if she's not feeling comfortable, then there's an issue with how you guys are treating her. So let's get to the bottom of that. And then if we can't get to the bottom of that, I'm sure the hospital's mission is inclusivity. So maybe you need to find another job if you can't abide by our mission and our values.
Okay. I was just asking because, I want to make sure that we are all inclusive, because there's other races that are going to say, well, I feel discriminated against when I'm a minority and the majority is African American, or I feel like a minority when I go in. And I'll tell you, like here in Texas, I know because I do clinicals, and when I go into certain facilities, I'll see there's a huge African dominance when I go into certain places. So especially if it's a lot of LVNs, I feel like there's a lot of like an African community. And sometimes my students will tell me that they, even though they're black, they get discriminated against the Africans because I don't know. And I'm just like, oh my God, it's too much. Too much.
It's true. It's very true.
That's why I am no longer a practicing nurse. I leave that to y'all young folks, because the way my nerves and my life, like I done built up this whole holly cotton. I cannot let it go for somebody who gonna catch these hands today.
Usually, when prior to us going to work, we listen to our gospel music. We pray every day.
Have to.
Throughout the shift, because like Kionna mentioned, everyone thinks that we're just making a plethora of money. And we're just have this great life, and you never know what someone is clocking in, and emotionally, mentally, spiritually, what they have on their plate. And in the emergency room, I'm not downgrading any other specialty, but in the emergency room, you have to be on your P's and Q's. You can't miss anything because other people's lives are at stake. So definitely have to continue to pray every time we go into work, because
absolutely
it's a test.
It's necessary.
Yeah.
Because you can't drink, so you got to pray. I get it, girl. I get it. Since I can't drink no liquor, let me call on Jesus. I got it.
Behind the cross.
Yes, Lord.
Pray with me, don't play with me.
Yes.
Okay? Because we all have it in us.
Absolutely. Trust the play.
Yeah.
I know. I always got to be like, listen, don't let this fool you, okay? Don't let Holly Cotton don't let Professor Cotton get you messed up today, okay? Don't let it. Okay, so we talked about all of that, what happened, the mission, all of that. So now what I want you guys to do is, for anyone that wants to follow, like, support you guys, how can they support you? What are you wanting to, what is our call to action from bringing this issue into the forefront and highlighting this?
Well, you can reach out to us at PS It's Confirmed on Instagram. You can send us an email.
Tell anyone how they can like, support, follow you guys.
Okay. On Instagram, PS, the letter P, S underscore It's Confirmed. Send us a DM. We read all of your comments. We read all of our messages. And at Gmail, PS It's Confirmed at gmail.com. We want to hear from you. We want to hear your stories. We are moving forward in pursuing action, possibly filing a complaint. We are on board to litigate if we have to. We are fighting with you. We're fighting for you. We're standing up for you. So please reach out to us, even if you want to remain anonymous, and just share your story, because we see your comments that everybody is going through this, and it doesn't just have to be nursing. Also, if you were in, can I say, Detroit, on a crisis assignment from December 21 to March 22, we definitely want to hear from you. So that's how you can reach us.
Okay, good. I love that. Yeah, we just didn't want to say their government name, but yeah, you can definitely say the the location.
I don't
And
want
so
anybody
the last, I know, especially me. So the last question that I have is, so for anyone that's going through something similar right now, because I always try, and at least when I do a little highlight reel on my social media, I always try to show little things that other people may not know that they're going through, to inspire other people, or maybe, something that they can use to make their life better. So maybe there's someone right now that's like, wow, I feel like I'm going through something at my job. I don't know. I don't want to get terminated, but I feel like something is awry right now. Is there any recommendation that you would have for someone that's going through what you guys went through at this very moment?
I would say documentation. Document. I would, if you have someone that you trust, bring that to their attention, because it's so crazy. During this process, Kionna and I, we created a binder. We have text messages, because this was 2 years ago. But even with it being 2 years ago, it's still
fresh.
It's still fresh for us, because it was a very, for me, very traumatic
Yeah.
traumatic experience. So I definitely think documentation is the key. Text messages, put in your notes, this day I experienced X, Y, and Z. Document the names.
Follow up with emails.
Yeah, absolutely.
Request communication in emails. Take a partner with you. We travel together, so if I'm going to go have a conversation with somebody, if I'm going in the room and they're problematic, I'm like, hey, come with me so I can have a witness. At the end of the day, take care of yourself. These jobs will hire another you in a minute. Your family needs you. The world needs you. Your mission needs you. So take care of your mental health. You can find another job. If you are spiritual, pray. I live by the verse, trust in God with all your heart and lean not on your own understanding. Because we don't understand things that happen to us, but we still have to trust. So if you believe in that, definitely send one up to Big God. He's going to show it to you. And definitely keep documentation. Take a witness.
Okay, great. Yeah, I wanted to just have some advice because, again, they might be going through it and they're like, what do I need to do now? Or should I be doing something? And again, with you guys, in retrospect, you're like, oh, I wish I would have done this, or I wish I would have had more of that, or I wish I would have had this. So I appreciate you guys sharing that for someone that might be going through something similar. So, all right. Well, I will have all of your information in the podcast notes as well. And yeah, and then we'll have it spelled correctly in the podcast notes so you can have clickable links. And we're going to work on getting you guys a website so people can come click on the website, follow your journey. Like you said, you want to have this little clique of people kind of sticking together. So I love that. I love that. So that is Key and Q, you guys. Thank you.
Thank you.
Thank you so much.